Thank you, everyone, for tuning in today, Tuesday, after the Thanksgiving weekend. Hopefully, you had a great weekend to see family and friends from afar and reflect on what you're thankful for. Certainly, we were able to do that in our family, and we certainly hope that the results in the next couple of weeks bear out that folks have done the right thing over this weekend. Just a quick reminder on these media briefings. We restarted them as COVID cases continue to rise in Hamilton and across Ontario. So our team felt it important to resume our regular media briefings and public updates now up until Christmas. Also, we will be restarting this Thursday. These will occur twice a month on alternating Thursdays at 7 p.m. Thank you to 14 and look forward to your questions at our community events. In terms of updates, Thanksgiving wrap up. Thank you for doing your part this Thanksgiving weekend by celebrating safely and doing your part. Now we'll hopefully see us celebrate the holidays together in December. Remember to avoid coming you don't live with in your household. Don't gather indoors or share food, and always wear your mask if you're inside or can't keep your distance from others. Please continue to do your part to stop the spread of COVID-19 in our community. It's a critical time as we're seeing the increase in rise across the province and in our city. A critical time to bear down, do the things that public health is asking you to do. Remember that this spread in this virus can be on you and be spread into someone else unwittingly. And so maintaining some physical distance and wearing your mask is critically important now. So please do your part. In terms of the some of the outdoor spaces that we've talked about before, the waterfalls, it's certainly a great time of year to be out to enjoy the fall colors and enjoy the trails and waterfalls. We ask you to work with our partners at the Hamilton Conservation Authority, who have adopted new measures in place to ensure that everyone falls. Plan ahead and check with conservationhamilton.ca for information on how to reserve your spot. Uh, we want to limit the number of people gathering together. Only visitors with reservations will be allowed to enter. So, and parking, if you're parking illegally outside the parking lots, you could face a $250 fine for doing so. So these are the major falls: Tews Falls, Webster's Falls, Dundas Lookout, and Devil's Punch Bowl all fall into that category. Do check with the Conservation Authority, conservationhamilton.ca. Get information before you go. I understand the reservation system is working very well, and it's working well for not only people that are attending, but also working well for the local neighborhoods that these waterfalls exist in, which obviously, if you're parking all over the roads and all over the road allowances, is particularly unsettling for people that live there. So be mindful of that, and don't subject yourself to a $250 fine. Call ahead, get a reservation. I'll now pass it on to our Emergency Operations Center, Paul Johns. Paul.
Thanks very much, Mr. Mayor. And not any particular updates today. I just do want to say, in the spirit of the holiday that we celebrated this past weekend, that yesterday on Thanksgiving Monday, it marks 7 months since we activated our Emergency Operations Center on obviously March the 12th of this year. And I am very thankful for all of the city staff and our partner organizations that continue to do what is required in order to deal with this. People say, well, it's not an emergency anymore. Well, for us, it continues to be a daily view in terms of what's happening in our community, what we need to adjust from a service delivery perspective. We're still working through our Hamilton Reopens plan. So in terms of crisis and chaos, it's maybe a little less of that these days, but we are certainly doing everything we can to continue to ensure that our community remains as safe as possible. And we connect in often with our public health colleagues to see what more can we do from an operations perspective that will help ensure this community does not have to head through what other communities are experiencing, which is a return to some modified closures and severe limitations of activities within the community. I do get questions because people are, of course, tuned in a lot to the Toronto media about is this closed, is that closed? And a reminder that Many of the more significant restrictions that were announced last week were for three areas of the province: Ottawa, Toronto, and Peel region, not for the city of Hamilton. Our website provides you with lots of information. I know there's a lot there, and sometimes you have to wade through some things, but it's always the best place to go. We keep that as updated as we can in terms of the latest information for folks. So, not as many severe restrictions. We're trying to keep it that way. The mayor's indicated the core message that we continue to provide is no deviations from the plan to keep people safe. For us as individuals, when we go into establishments or we're engaging in services in the community, comply fully with all of the measures that are there. And for the operators of those services, be they nonprofit, city services, for-profit commercial ventures, also don't take any moments off. Make sure that I know sometimes it's a confrontational piece, but we really do need people to comply with those rules 100% of the time. And it's easy to say, well, it's just this, or well, we'll let that go for this time. The reality is, the more we let go, the more we increase our likelihood of having some of that transmission take place that we don't want to. So if we want our community to stay where it is and continue to progress, I think it's really important that we follow those messages that the mayor just talked about, and I know Elizabeth is going to talk about as well. I do want to acknowledge this morning I was part of the advisory committee for our BIAs across the city of Hamilton. I had a question and answer session with them and acknowledged at the beginning of that just how difficult I know it's been for all businesses, not just those in our BIAs, but all businesses in Hamilton. And I heard some of that, a lot of the anxiety about how can we stop us from heading down the path of having another, what they call shutdown, but a severe restriction on services. And the answer is the same. Follow those guidelines, the rules that are in place. Be very vigilant as individuals and as patrons of those businesses, and also as the owners and operators of those businesses. And we will continue to do the right things. And if we do that, we'll continue to see numbers at a manageable level. But we are definitely in a period where there's a heightened awareness from the Emergency Operations Center about what's happening in the community. The numbers are not going in the right direction. We've seen over the last number of days a major increase. And so we are being very methodical and even slower sometimes in some of the reopening that we had planned maybe to do in October and November. We're now looking at whether we need to push some of those things out, and would encourage people who are planning events and things like that to, again, think very strategically about this. Is this really the time to be putting in an event application? You're likely going to get 1,000 questions from us, and perhaps also a discouragement of running those events, even if they do comply with some of the rules that are out there. If they're using city facilities or city areas, we're just in the mode right now where we want people to keep, again, fairly close to home, fairly small amounts of contact, and we think that will serve us well as we go forward. Dr. Richardson?
Thanks very much, Paul. And I'm going to give you a case update and then just go over some of these issues. You're going to hear these same messages from the mayor, from Paul, and myself today, just because it is so very important that we're following these measures. We do not want to go back into a lockdown state. We don't want to even go as far as Toronto, York, and Peel. Toronto, Peel, and Ottawa, I should say, have had to go over the last week or so. And so it is so very important that everybody is following these measures so that we can keep our case counts low and protect those who are most vulnerable. So today we're at 1,407 cases in total as of today. That's 12 new cases from yesterday, but I do want to say that's a total of 111 new cases over the long weekend since Friday's update. So we're now sitting at an average, a 7-day average of 25 new cases per day. That's the highest level we have ever seen, including when we were going through the first wave. At present, 83% are resolved, 194 active cases for Hamilton, and we still sit at 47 deaths to date. We are reporting 27 school-related cases and a total of 3 outbreaks, not school-related outbreaks, that are in a variety of settings: Spinco, Dundurn Place, and still finishing up with the another outbreak. And then we've just issued a media release just a few minutes ago with a school outbreak, actually at Sacred Heart of Jesus Catholic Elementary School, that's going to be added to the website shortly. And so I do want to remind people of these things that you've heard the mayor and Paul talk about. It is very, very important that if you aren't feeling well in any way, that you stay home. Even if it's just a few symptoms, even if it's just really mild. You have to remember when it comes to infection control for any viral illness, the rest of us really don't want to get it as much as we can. And so you should stay home and not leave until you've been feeling better for 24 hours. But particularly, that's really important during COVID. And we are unfortunately seeing some people, they're going out, even if they're feeling symptomatic, even if they've gone to get tested while they're waiting for their test results, they're still participating in things and going out. And so it is so very important that if you're feeling ill in any way, stay home. If you think it's just something that is like what you've had before, it's allergies or something like that, give it a day, give it 2 days till you make sure that that's the case. And if it is something at all like COVID, please go get tested. We are also seeing as well that there are people that are not using public health measures. They may not be using their mask. They may not be using physical distancing. And so it's really important, again, that everybody continue to do those things. And you've heard Paul talk about how we all have a responsibility in this. We have a responsibility to do it ourselves, but we also, whether we're a business owner or an organization, we have a responsibility to make sure that it's happening in our spot. And so I think sometimes we think, for example, if we're going out to a restaurant, it's like, oh, good, we're at a restaurant. I can take off my mask while I'm here and just talk with the person or persons that I've come to the restaurant with. But really, you should keep it on the whole time that you're there, and only take it off while you're having a drink and put it back on. Take it off while you're eating your food and put it back on. And so it's up to all of us to look for keeping those measures in place and only removing them a mask or changing the distancing when it's really indicated to do so. So again, restaurant owners, sports team organizers, whoever it is, they too have a role to play in making sure that these things are followed in order to keep everybody safe. I do want to note as well about assessment centers. Just a reminder that there have been changes to the assessment center locations. The drive-through assessment center at Dave Andrechuk Mountain Arena is now closed. And so the current locations are the East End Assessment Center, the West End Assessment Center, St. Joe's Mountain COVID Testing Center, and we have broader hours as well. So you can find the details on the website, but just wanted to flag that those are now the assessment centers that are in place. And as of Friday, October 23rd, so not this Friday, but 2 weeks um, away, we will have the St. Joe's Healthcare Mountain COVID testing center set up at Mohawk College's Fennel campus. So that will be coming up next Friday. So all of the information around those, and if you need to book an appointment, you can go to www.hamilton.ca/COVID testing. That's it from me, Mr. Mayor. Back to you.
Thank you, Doctor. Thank you, Paul, for your ongoing work. And I just want to take a minute before we pass it on to Jasmine for media questions to acknowledge and thank our public health workers. There are hundreds of people working double time to contract, trace, and stay on top of this virus to help contain the virus as much as possible. Many, many more folks that I may not be used to doing this kind of work have been pulled into service, and I just want to take a minute to thank them for all of their effort. This is above and beyond what they would normally do on a day-to-day basis, and I'm sure it's taxing and wearing on them. They're again working double time and overtime to get all this work done. And I just want to ask Dr. Richard to pass on my gratitude on our behalf for all the work they're doing to try and contain this. Contract tracing is not a simple matter. We've got an app, but it still takes individuals getting a hold of, in the case of spins, not just 51 people, but now hundreds of people that have been in contact with those 51 people. So the massive amount of work to get all of that work done is just amazing. And there are people doing that day in and day out to serve our community. So thank you to all of them. And on that note, we again, of course, thank all of our public health workers, our cleaners, nursing home staff, nurses that are working double time on these issues as well. All of the frontline essential workers that keep our city functional. Thank you for all your effort and work, and for them we should be doubling our efforts to avoid the spread of this virus as much as humanly possible. A lot of people are putting an effort to help prevent that, and certainly we can do our part. Jasmine, I'm going to turn it over to you, and we're ask for some media questions at this point.
Great. Thank you, Mr. Mayor. As usual, we'll start with one question and one follow-up. First question goes to Amina Zafar from CBC News. Amina, you can go ahead. Sorry, Amina, I just have you on mute still.
Hi, this is a question for Dr. Richardson. Thank you. Is the SpinClo class event considered a super spreader event, and why or why not?
Hi, Amina. Thanks very much for the question. So for us, we don't tend to use the word super spreader. It's one that was coined, I think, back in the days of the initial SARS outbreak, and it's not one that we particularly use. So in this case, what I would say is it's a large outbreak. There has been a lot of transmission associated with it. It is concerning in that it has extended, of course, beyond the initial cases who were related to the classes, but gone into, of course, their household contacts and other contacts. So it's a very large outbreak, and we continue to look at what does it mean, what do we need to understand about exercise classes and all of these sorts of things in terms of control measures. There are guidelines in place, but we work with the province to look at whether those need further refinement as well.
Thank you.
Did you want a follow-up question, Amina?
That's good. Thank you.
Okay, great. Thank you. Next, we'll go to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you. I hope everyone had a great long weekend.
Bobby, sorry, I'm just going to stop you. Can you speak a little bit louder, please?
Yeah, no problem. Anyway, I just wanted to say I hope everyone had a good long weekend. Thanks for chatting with us today. My first question, I guess, is for the mayor, and if anyone else wants to chime in, feel free. How concerned are we that we're going to see some more restrictions or go back into stage 2 instead of being in stage 3 right now?
Well, I'm personally very concerned. We're seeing the case numbers being higher than when this pandemic started back in the early days of March and April. So that's a concerning number. We are more prepared, that's true, but these case numbers are climbing, and the impacts of whatever might have occurred over Thanksgiving could very well lead to higher numbers as well. Having said that, I do appreciate the strategic approach that the province is trying to take. It's a fine line between keeping the economy going and keeping people employed and keeping services running, and at the same time trying to manage a pandemic, a spread of a virus that is still very much with us. So I'm worried about it. I'm concerned about it. That's why we're encouraging people to double their efforts, get back to hopefully not a complete shutdown, which I think will be devastating for our local economy as well as the economy of the province and the country, quite frankly. I think many small businesses out there, tell me that if there's another shutdown, they won't survive. They survived the first one by taking advantage of some of the resources that are out there, but they've tapped out those resources already, and there's just really not a second wave opportunity for them to survive it. So we really need to avoid that second shutdown. And as much as Ottawa, Peel, and Toronto have been affected by increasing cases and shutdowns in some select areas, we may have some select areas that are going to be impacted as well. I think that remains to be seen over the next coming days and weeks. But if we redouble our efforts and get back to some of the very important safety measures that public health continues to share with the community at large, we could potentially avoid any further retraction into shutdowns or any curtailment of activities. So I'm hopeful that people will hear that message and redouble their efforts.
Thank you. And my second question is, I guess, for Dr. Richardson. We now have our first outbreak in a school. I'm just wondering, is there any type of trend, or do we know more about how COVID-19 cases are getting into schools?
Thanks, Bobby. I don't think there's really any trend that I would say we're seeing at present. I think overall, when we look at schools in general on a broader scale, whether it's across the country here in Canada or elsewhere, what we do tend to see is that transmission isn't so much amongst the smaller kids. So unlike some other diseases where we, really say, oh, the kids are the ones that are spreading that around and the adults are getting it, that's not the case for this particular virus. What we tend to see is there's not a lot of spread amongst the younger kids, but more so spread amongst teachers, amongst the adults that are in the school, or amongst older kids. So that's generally the trend that they have seen out there, and we're just we're watching to see how it unfolds here. Our schools have done a ton of work in terms of making sure they've got, the right PPE for people, that they distance kids as much as they possibly can, that they are making sure that people are getting screened every day and those sorts of things. So they're working hard at it, and we're going to see cases in our schools because that's what's going on in our community. We're having an increasing number of cases, but so far this is the first time we've seen transmission that we think might have actually occurred in the school setting. All the other ones have been transmission from outside the school setting from what we see so far.
Thank you, Dr. Richardson. Next question will be to Lisa Pileski from CHML. So Lisa, you can go ahead.
Hi, can everyone hear me okay?
Yep, sounds good. Thanks.
Okay, I'm not sure if this question would be for Dr. Richardson or Paul Johnson or both. I I know, Paul, you mentioned during the BIA kind of discussions about the concerns whether of the impacts of a second wave and how that may lead to more shutdowns and how business owners can't deal with that. And you say basically if people follow all the regulations that are in place and the public health guidelines, then they should be okay. What about the situation with Spinco and the fact that there have been so many cases that have arisen from that? Is there something that went wrong there? Were they not following public health guidelines, or were they? And this was just unfortunate.
So why don't I start off with that one, Paul, if you want to add anything afterwards. So we've been working with Spinco, and they've been very collaborative with us in terms of everything that we've been doing as part of the outbreak investigation. And when we talked to them about what they were doing beforehand, they had removed 50% of the bikes so that people were further apart. They had made sure they were laundering towels. They had done all sorts of things to try and reduce the potential for spread. But unfortunately, gyms are a higher risk place because of the fact that generally people are taking off their masks, they're breathing at a higher rate and more deeply, and especially in classes where there's coaching going on, that tends to be at a louder tone in order to do it over music. So that's why they tend to be higher risk settings. So I think very much, Spinco has been an unfortunate case, to use your words, Lisa. But absolutely, we're working with the broader province to say, okay, are there other measures that need to be looked at in terms of gyms and how they work? In the meantime, we can definitely say, these are some of the things that you can do to further reduce your risk. Not have classes where you've got that kind of yelling or coaching over music or that sort of thing. Making sure you've got that distancing, perhaps reducing further the number of people who are in the class. And indeed, what seems to be the case is that you need to wear that mask, even though it's not absolutely necessary according to the provincial guidelines. It's still a good idea to do it in terms of keeping others safe, unless you absolutely cannot. And then the last piece is, of course, again, if you're not feeling well at all, don't go to the gym. I know a lot of people, they like to sweat it out and go to the gym when they're not feeling good and get that workout in and they feel better, but it's not the time to do that. Right now, it's the time, if you're feeling off at all, go for a walk outside, go for a run outside on your own. That's the thing to do until it's really clear whether or not you're sick.
And just to clarify, a little bit about restaurants and things, a conversation that we had this morning, it's how do we lower our risks as much as is possible. And I think the message is do everything that we're supposed to be doing, encourage the patrons to make sure that the restaurants are. And those are those little things too. Don't crank up the music so that you encourage people to speak more loudly. If you're a place that's known to have a fair bit of music going on, turn that down. Wherever we can get more airflow, those are important pieces. And so I think it was a conversation about all of the things that we can do to lower the risk. We've been in pretty good shape from a restaurant perspective so far into this. And, I think the conversation this morning was about redoubling our efforts to just ensure that there is no pass on any of this. And we shouldn't be taking that personally, but as purveyors of these places and as owners and operators of these places, we need to make sure that everybody is enforcing them. And I know it's tough, and I know it feels perhaps not in the best spirit of being a friendly atmosphere and the good customer service. But to be honest, the best customer service is to maintain the ability for people to take out food and in safe ways come and enjoy the food at the restaurants. And so in order to do that, you may have to be a little bit tough in terms of the rules. And I can speak from our experience here at the City of Hamilton with our employees and with the work that we do. We have lots of in-person work that goes on. We have lots of people that are having to work in teams. We are, some people will say, relentless. We are certainly very religious in our conversations about the need for people to follow all of the measures: mask, keep that physical distance, don't meet together just for the sake of meeting together. Even people that are in office places, phone calls using the web connections that we have may still be the better way to do it, because every time we do something that puts us at a higher risk, we put ourselves at a higher risk. And why do that? And particularly at this moment in time where the cases seem to be rising, and we are hitting this moment of increased transmission, obviously, in our community. Why would we take those extra risks? And so I think that whether we're talking to business owners, whether we're talking to our own employees, it is that same message of this is the time to be absolutely vigilant on the things that we know offer as strong a protection as we can, recognizing that there are very few ways to have a no risk activity in life. And when we're out and about, it's really about, as Dr. Richardson says, lowering that risk to as low a possibility as it can be.
Oh, okay. Thank you very much. And I guess my second follow-up question is also for you, Paul. It's about the dismantling of the encampments and how that process is, I guess, about a week in or so. Just wondered if you could comment on how that's been going in light of the rise in COVID-19 cases and the need to get people who are homeless into situations where they're not risking further spread of the virus.
Yeah, so the good news is that our shelter system obviously has been working through how to keep its population safe right from the beginning. And so they have very well honed process in place in terms of screening and testing protocols, rooms that provide isolation within the shelters if somebody is exhibiting symptoms of COVID-19. And then we obviously have also funded a separate isolation shelter should anybody test positive, and we obviously move them out of the general shelter population and have them recover in our isolation shelters. So those pieces are in place. We have increased shelter spaces because of the work that we've been doing over the summer months, to be honest, to be ready for the fall and to be ready for the winter. We have shelters now that have done some capital work to ensure that the physical distancing can be maintained, and their numbers are back up. I was pleased to hear today that the Booth Center on York Boulevard is back up to more of their traditional numbers. They had been quite a bit reduced. The Cathedral Boys School is now a shelter. It has up to 45 spaces. And we have a number of hotel rooms, including an increased number of hotel rooms for couples and for women. So we feel we're prepared. I know there has been some movement of people late last week, and today we're out there in earnest again. It's going to take a week to 2 weeks to work with those who are on the street. And the numbers got up to over 100 people who are sleeping rough on a night-by-night basis. So it took us a while to get here. It's going to take us just a little while to get back from that. But this week is a big week. We're doing work, particularly at Ferguson Avenue, First Ontario Centre in Whitehorn, to reduce those numbers down to zero, because in the future it's prohibited to be encamped in those areas. And then we'll continue to work with other folks who are in the community as well. So this is a week of tremendous effort, I know, from our outreach teams and our social navigator teams and our shelter partners who are operating the shelter spaces and hotels. And by all accounts, we are getting some people into those spaces, which is great news, and that will be accelerating through this week and into next.
Thank you.
Thanks, Paul. Next question is to Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks very much for taking my questions. So my question is for Dr. Richardson. So the SPINCO says that the person was asymptomatic, and I'm wondering if that's true and how many classes they attended and maybe whether or not they followed the rules and how you know that they followed the rules.
Thanks for the question, Kate. Unfortunately, I can't speak to any specifics in terms of any of the cases. That's all covered by privacy and confidentiality, and we can't speak to those. When we look at it, as I've said before, we have had tremendous cooperation from the owners and the operators of SpinCo, and they have put in the public health measures that they were required to under the guidelines when we've investigated and looked into those, and they've been great about making sure that people get contacted. So we do sometimes have some people who are symptomatic, but I can't speak to exactly what went on with each case in this situation.
Yeah, thanks very much. And so my follow-up question is, you've said many times that the gym has followed the rules, and I guess I wonder if you could share with us, provide us a bit of insight into how you know that the gym followed the rules, what kind of investigation took place, and then in light of this, are you looking at other gyms and whether or not they're also following the rules?
So in general, when it comes to these kinds of investigations, and in this case in particular, when we have the first sort of inkling that there's an outbreak, we find two cases that are related. We've interviewed those cases extensively in terms of what they've been doing, what's been the settings they've been in, who they've been in contact with. And then when we have a setting where we think the outbreak might have happened, where the transmission might have occurred, then we go to that setting and we review with them exactly what it is that they have done. How have they spaced things? How frequently do they clean the premises? Are they following all the elements of the guidelines? Are they exceeding the elements of the guidelines in any ways? And so we go through each place and do all of those things to ensure that that is indeed what they're doing and that they are following the guidelines. And are there any areas where they may have misinterpreted them, or are there any things where they could do a little bit more to try and give them good advice about what they can do going forward? And in this case, we did indeed, as I said, find that they were following the guidelines, and now we're looking at, is there more they can do? And those are those things that I would say for all fitness classes in general are things like, don't have the music cranked so people have to talk over it. Don't be coaching and yelling in loud voices, either the person from the front of the room or the people who are in the room. Wear masks if you can. And so that's sort of the general stuff that's coming out, but we'll look at it more systematically to see across the province. We've asked the province to look at it to see if the guidelines should change.
Thanks,
Great,
Dr.
thank you.
Richardson. Next question will be to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. This is for Dr. Richardson. So today, Premier Doug Ford said he'll be reaching out to the Hamilton Region Public Health to discuss this outbreak. Has there been any communication with the province, and will you be looking to them for further restrictions on gyms or anything else, such as like a spin studio or yoga studios?
Sure. Thanks very much, Fallon. So yes, we have been talking with the province about this outbreak. We discussed it with them last week in terms of what we had found, and just, asking them if they had any further advice to give in terms of what could be done in this situation, or further things that they've observed in investigating other outbreaks, knowing that they decided to put in further restrictions in Toronto, Ottawa, and Peel, and just wanting to understand what they had seen that led them to advise that. So we have been working with them, and we've been saying, should we be looking at these guidelines and looking at whether more is needed in order to reduce transmission? But we haven't seen issues with gyms elsewhere. We haven't seen them in terms of cases being related to them, and so I think it is a matter of taking some time to look at, is there further changes that need to be made.
Thanks. And my second question was about the number of exposures. So last week it was potentially 100 members, and then earlier on in this, the mayor said it had reached into the thousands for contact tracing. Can you confirm how many secondary exposures there were? And in light of this, do you have any advice for people going to gyms? Like, are spin classes safe, and what do people need to do to protect themselves when they decide to go to the gym?
Sure. So, as you heard in terms of the actual case numbers, we're at 44 cases. There were several particular classes that happened over a few-day period that we were looking at as might have been the classes where people may have become infected. There have been 17 more cases that are what we call secondary cases that have happened outside of the SPINCO group, membership group, where there's been transmission to others. In terms of the total number of contacts, I can tell you from the initial part of the investigation, we were at 100. We haven't then kept exact count on how many of those people have had contacts. In general, we're up to having sort of 20, people having more like 20, 25 contacts per case that we investigate. So we haven't specifically tracked contacts for this outbreak, and we don't do that generally. In terms of people deciding to use the gym, this comes back to what I was saying earlier about really encouraging people to make sure that there's the distancing in place in the classes, making sure that they're following all of the measures when they're coming and going from the gym. They're wearing their mask whenever they can, including both when they arrive and when they leave, but also if they can leave it on while they're lifting weights, while they're doing other things, then they need to be doing that. If they can do their exercise in another way. I think classes we still saw for a while that Toronto was doing them, Toronto, York, and I want to say York, Toronto, Ottawa, and Peel were doing them on a reduced class size. But I think, we all need to look at all the things that we're doing, and are there ways that we can reduce our own personal risks? So for somebody who goes to run on a treadmill, is it better to go and run outdoors right now while these things, while COVID-19 makes its way through? So we'll come out, we'll look at with the province, see if they come out, I should say, with further guidance more broadly. But for now, that's the advice we're giving.
Thanks, Dr. Richardson. Next question will be to Jason from CHCH. So Jason, you can go ahead. Just
Hello?
try to get, yep,
Hello?
there you go. Go ahead.
Okay, excellent. Good afternoon, everybody. My question is for Dr. Richardson. I'm just getting word that Dr. Williams mentioned that Dr. Richardson has the power to shut down gyms. I mean, can you confirm that, and will you do it, and why?
Hi, thanks very much for the question. Absolutely, the medical officers across the province, we do have the power to shut down things more broadly in our own jurisdictions when we see that there's a reason to do so. In this case, SPINCO has closed. They closed as soon as they knew that there was an issue related to those classes, and so that setting has been shut down. And as I said, we're working with the province and looking at the fitness guidelines. We know they're looking at them, putting them under review. If we saw something that extended beyond this one particular instance, we would definitely move to do something more quickly. But right now we're taking the time. Again, as the mayor and as Paul have said, we want people to be able to operate their businesses and go about their lives as much as they possibly can, while continuing to look at where are the higher risk activities and bringing them down. So for now, again, saying, make sure you're wearing your mask, make sure you're distancing, turn that music down, don't be yelling and doing those things that are increasing the likelihood, the risk of spread. And while we look at this and see if there's more that could be done.
Okay, yeah, a follow-up question again, Dr. Richardson. The school outbreak at obviously it's either 2 or more cases, but do we know how many cases actually happened that you have tested positive, so like that we have so far?
Sure, absolutely. We have 2 cases that have tested positive in this outbreak, and so that's why it met the outbreak definition.
Okay.
Great, thank you. Next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, Dr. Richardson. Thank you for taking my questions today. Last week, you talked about the backlog for testing being 8 days and contact tracing being about 48 hours. Can you update us on where that's at now and whether that situation is getting better or worse?
Thanks, Joanna. So I said we could be up to 8 days was what we were seeing with our test results that were coming through when we're doing the case management. And I would say we're still seeing backlogs that could be definitely that far out. Not every person's test takes that long to come back, but that certainly is still what we are seeing. I don't have any other sort of official stats from the labs that I can share. I don't know if the province has been tracking those times themselves and might have something more specific. When it comes to contact tracing, we have been doing a number of refinements to try and keep at that 48-hour mark that we're able to contact everybody. And so we were just talking about more of that today. And so it's very much with the number of cases we have, the number of contacts that they have in this new environment. It is a challenge to keep up with contact tracing, and we're just continuing to look at how we can do that.
Okay, thanks very much. Can you also talk about the rolling 7-day average and the increase in cases, as well as the positivity rate? Like, can you talk about whether the positivity rate is still going up, and do you have numbers to show that increase?
Thanks, Joanna. So in terms of the number of cases per day, we are sitting at 25 new cases on average, that 7-day moving average. And so that is a higher rate than we've experienced ever before, as I said earlier. In terms of positivity rate, Joanna, I'm going to have to get back to you on that. I don't have that off the top of my head. But certainly last week we did see that rate start to creep up. So that's the number of tests that are test positive out of the total number of tests that are being done. And so, this again speaks to the fact that there are more cases out there. It's not just as a result of us being able to do more testing. But I'll get back to you with the specifics of the positivity rate if we have it yet from the province.
Okay, next question will be to Katrina Clark, also from the Hamilton Spectator. Katrina, you can go ahead.
Thanks for taking my questions. I'm wondering about the spin studio itself and plans to reopen in the future. The studio said that they do plan to reopen after that 14-day period has passed. Is public health supportive of that, and advising that there be additional measures that the studio takes?
Thanks, Katrina. It's really too early to tell. I mean, they are staying closed right now as we continue the outbreak investigation and continue to understand what happened and where it's going from here. We'll work with them as we go forward in terms of when it's safe to open, what measures need to be in place in order to reopen, but we aren't at that point yet where we can say what those are.
Okay, thank you. And in terms of the individuals who do have COVID as part of the outbreak, is there anything you can say about demographics, like how old most of the average age maybe of the people who are sick, and if anyone is especially sick in hospital, or what their condition is?
Sure. At this point, we still have a low hospitalization rate overall, and so we have not seen a lot of cases in this wave. Partly because we are seeing it in that younger age group compared to what we saw before, and we were seeing cases and outbreaks happening in long-term care, and so that is a concern that all of the continuing spread of COVID-19 will ultimately lead to that. But in terms of this particular outbreak, no, we haven't seen any hospitalizations that are related to it. It's about let me get my numbers right here. It's about a 3/4 female, 1/4 male split in terms of the gender that is there. They're happening in ages that range from late teens all the way through to late 50s. So it's a fairly broad spectrum of individuals who chose to use this service as one might expect. So there's not something really further that I can tell you in terms of characterizing the outbreak.
Great, thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you for some closing remarks.
Thank you. I want to do a question to Dr. Richardson myself, actually. So Doctor, could you talk about the social bubble and the household recommendation we're talking about? Because I think there's some confusion out in the broader community in terms of what applies now and what doesn't. So could you provide some clarity on that?
Absolutely, Mr. Mayor. So the whole piece about the social bubble, it's some language that was confusing all the way through. I think for people in terms of understanding, did they have one bubble, two bubbles? Was there a work bubble, a household bubble? And so really, we're saying, let's set that aside in terms of looking at our social bubbles, but really just talking about the number of people you have close contact with. And really, that's what the social bubble was supposed to be about: the people that you would hug, the people that you would share a meal with, that sort of thing. And saying, let's keep that to a smaller number. So we're saying keep the number of people who you have close contact with small. If you can limit it to your household or to, one other person that you're helping to support who happens to live as a single person in the community, then that's the ideal in terms of what you'll do. If you do choose to go out and socialize beyond that, it really should not be with any more than the 10 and 25 guidelines. So 10 people if you're indoors, and even then you're physically distanced, you're wearing a mask, then all those control measures kick into place. And similarly, in terms of whether if you decide to go and do something that is outdoors. So really, if we're thinking about it, it's just your household really that you should be having any kind of close contact with. It's still okay to go out and shop. It's still okay to, do some of those things that you need to do. But again, be thinking about it. Do you need to get out and do those things today? Does it need to happen? Or is it something that you can do in another way? So that's, I think, Mr. Mayor, does that cover your question or do you need a follow-up?
Yeah, I need a follow-up question on that. So you know what, in terms of the social bubble, for all intents and purposes, we're not asking people to practice a social bubble anymore. That's kind of out the window. And so, it used to be a social bubble of 10, 10, close family members or individuals that you were quite familiar with and knew you were relatively safe. You could relax a little and hug and do all the things that you would normally do. We're now saying social bubble, no. Try and stay within your own household and limit the amount of people that you're in contact with, including, you know, even family members that may or may not have kids in school that could potentially add to the spread. Right? A
Absolutely,
loaded
Mr. Mayor.
question.
What you said.
Yeah, I think that's a really important issue because I think people are still kind of operating under the social bubble guidelines, and I think that social bubble is, we've kind of said no, that's not appropriate right now. Right now, we need to kind of retreat back into who's in your household and limit it to that as much as humanly possible.
That's right.
All right. Okay. That wasn't a question. That was an answer. Thank you, Doctor, for answering those questions from the media and myself. And thank you to Bill Custers and the entire team at Cable 14, of course, McLean Media, that ensures that we run this smoothly and continue to adhere to all of the public health measures, including the discussion around your household, limiting your contact with people as much as possible. If you're sick, stay home. As doctor said, give it a couple of days to ensure that it's not a COVID related issue, and keep your distance from people as much as you can, and wear that mask. It's critically important that you continue to wear that mask, and washing down touch surfaces, and keeping your hands washed as much as possible. Best solution is soap and water, as the doctor would say. I'm not fond of the sanitizer, but that sanitizer definitely works. But soap and water for your hands is probably best. Stay tuned for our next briefing, which is October the 19th, next Monday, 4 p.m. And look forward to hearing from many of you in the community on questions this Thursday at 7 p.m. for our town hall. Thank you all for tuning in, and we'll see you Thursday or Monday. Thank you.